When we think about foster care, I think sometimes we forget that what that really means in child development terms is separations and interruptions and disruptions and transitions for children.
One of the other areas of evidence-based practice that we utilize is a model by Sue Lorbach called Safe and Connected. It's based on years' worth of experience in child welfare practice.
Safe and Connected is a framework that allows caring individuals that have a stake in the child's treatment and general development to come together and process difficult situations and come out of that session with answers.
Traditionally, we've always thought when we see a kid, what's wrong with you? And the shift of thinking at KVC, which I think is amazing, is what happened to you.
The anger and the arguments are reduced right off the bat. It's not about who's right or who's wrong. That in and of itself increases outcomes for our agency.
It is our duty as citizens to ensure that children are in a family setting, in the most natural setting possible, with people who are connected to them and who truly love them. And that will make the difference for them.
We have to put children that maybe have experienced years and years of adversity into safe environments so they can begin developing and starting to think of the world differently.
Safe and Connected simply factually reviews the information and synthesizes it in a way that allows team members to collectively determine next steps.
A person can be qualified to become a foster parent if they realize that the needs of the child come first and they know that they can really impact that child and make a difference in their life. And that sounds fluffy, but that's true. You really can change a child's life.
And so we have to help children and help families learn what safety means. And when we can develop safety, then that's when change occurs.
And to get that right family that puts them in the right environment that they need to thrive. So being able to see them thrive once they realize, these people, these families, they do care about me.
We just need to think very critically about what is the problem and what is the smartest, least restrictive intervention that we can do to keep the children safe but also connected to their families.
Any organization that is tasked with coming up with a systematic solution for a set of issues is ready for Safe and Connected.
We see the safe reduction of children in care. I think we see more families involved. I think we see more support given to foster carers to prevent multiple kinds of placements. So it's those bigger numbers that I think influence much more strongly KVC's impact.